In January of 2012, I was confirmed with cancer, and obviously, coming from a family with a lot of cancer, I broke the news to my wife and my 3 boys. All right, so once I had gotten discovery on proton therapy and went back and explained proton therapy to my family, everybody became active in the research of proton therapy, and candidly, that was like, as you mentioned, that was like the only way I wanted to go. Even though that I knew that surgery still was going to be an option, I knew that I wanted to go ahead and just pursue the proton based on what I read, based on what I researched, and having the opportunity for my wife and my kids to actually come down there with me and experience the process.
And that's very important when you go to these doctor's appointments. Take your spouse with you, and because they're going to think of things to ask that you may not ask.
That's a great point.
And take notes.
Yeah, because you're sitting there as the victim.
Whenever you walk away, I should have asked this question. I should have asked that question.
And so Linda, my wife, she was extremely nervous before going in there. But I remember after we left, when we had come down on February the 1st, I remember the day. It was a nasty day, but we felt really good after leaving that appointment. It's like, you know what, this is what we're going to do, because really what he had explained it so well, and we knew about it.
It's amazing, because once I learned about proton and did all my research on proton and the treatment, I was relieved to know there was a treatment that was right for me, and it just took a load off my mind that I know that I could go to Penn and get proton treatment done at Penn, because I was not interested in the surgery or brachyseed or external beam radiation.
Well, you know, when I got diagnosed, my wife came with me to the doctor, and he said surgery. And I said, well, I really don't want surgery. So we left, and we're riding home, and my wife says, you know, if it was me, I would want that cancer out of me. And I said, I've had so many surgeries, I don't want to go through that again. So again, she gets on a computer and she starts finding out about the surgery. And she finally said to me, she says, you know what, we need to find something else. She says, because it's scary, it's scaring me now. Where before I told you I would want it out, I think we're going to do the right thing and we're going to find something out. So with her computer skills that I don't have, we came to Penn Medicine, and that was a good thing. But yeah, originally she said, you know what, if it was me, I want it out of there.
That's what most people actually would
then
think.
she said,
you know, it's funny. Prostate cancer is extremely common, and I know right in our church, you know, we have a small church of about 150 people. 4 of us have prostate cancer, or had it, at least, and so, but all 3 of the 4, I'm the only one that chose to do proton, and they've had some issues.
I remember walking back the first time, I thought to myself, well, I have one guardian angel, my wife, but I didn't realize that I'd have 5 more waiting for me through those therapists. They were just unbelievable. Through the whole thing, they never talked about cancer. They would ask me, what'd you do over the weekend? Did you go to any restaurants? I like to play the slot machine, so they'd say, hey, you win any money this week, you know? And it was just,
Relationships.
yeah, it really was. And when I go up to see my doctor now, I always make sure I go down and say hello to him, and it's always a hug. You know, that's just the way they are down there. It was kind of bad for the last treatment.
Today, at the conclusion of my treatments at Penn Medicine, I'm feeling great. Put in real full days. Guys, for me, I just like nothing went on. I mean, other than
Exactly,
yeah,
that's a great way to summarize
right? I feel like,
it, because I'm back at I shouldn't say back at the gym. I never stopped. I lived in the Windsor Suites in downtown Philly, and they had a gym in the basement there, and I would work out at least 3 to 4 days a week there, because and I'm back to running again, and I just don't get sick or anything, and it's just been a symptom-free finish for me, and I've had 2 follow-up appointments, and they've both been very good, and so that's me.
I completed my treatments 2 years ago, April. I've done my 6-month visits on a regular basis. And when I go back in February, I'll be only going back once a year from there on. So they're very happy with my treatments. Of course, I've been back to work on a full-time basis. I'm not quite old enough to retire yet. Working in the transmission shop. But life is really normal for me now.
It's kind of like Gary said, just like it didn't ever happen.
Just like it never happened. It's hard to believe it's been 2 years since I completed my treatments. It just doesn't seem possible.
Yeah,
Yeah.
that's a good way.
Well, like when I got diagnosed, I had just been retired for about 2 months when I got diagnosed with cancer. And I said, this is not the way this is supposed to work out. So for, I would say 4 or 5 months, I wasn't really enjoying retirement. But come the end of May, I went, after my first PSA test, my numbers were down to 0.3, and my doctor says my cancer's in remission. So now it's having a good time being retired. I just take the dog to the park and help my wife out at home, and just, I'm enjoying it now. But there for a while was like, I didn't know what to expect, but Penn Medicine made it happen.